Hi, my name is Alexa, and I'm a security compliance consultant at MedCurity. Each year, the HHS, the office that is responsible for enforcing HIPAA, tracks the most common HIPAA compliance issues and complaints. From their research, they've discovered the 4 most common HIPAA compliance issues in covered entities that eventually result in violations. Today, I'm going to share with you those 4 issues and how to avoid them. The first problem is that covered entities are allowing impermissible uses and disclosures of protected health information, otherwise known as PHI. This means that the access, use, or disclosure of PHI is being handled in a manner that is not permitted under HIPAA, which may lead to a compromise in the security or privacy of PHI. A real-world example of this would be if 2 healthcare employees were discussing the physical status of a patient where other patients could hear that private medical information. A great way to prevent impermissible uses and disclosures is to train your staff on HIPAA compliance and then test them regularly throughout the year. The second most common issue is a lack of safeguards for both hard copy and electronic protected health information. The 3 safeguards as outlined in the HIPAA security rule are administrative, physical, and technical. Administrative covers the actions required by those in leadership to protect PHI, such as creating and implementing policies and procedures. Physical includes the standards that need to be implemented to protect both hard copy and electronic formats of PHI, so that only those who are authorized have access to it. Technical includes the technological policies and procedures that need to be followed in order to protect ePHI. The best way to avoid having weak safeguards is to create airtight policies and procedures and make sure they are actually being implemented in your organization. A great place to start with this daunting task is to conduct a security risk assessment and see which safeguards your organization is struggling with. The third most common issue is that covered entities are disregarding patients' right of access. The right of access allows patients to inspect, obtain, or send a copy of their medical information. The main problem that covered entities have is when a patient asks them to send their medical records in a digital format, such as through text or email. In an attempt to protect patient data from being exposed, healthcare workers often avoid sending PHI in electronic format, and sometimes they don't send it at all. However, the right of access requires covered entities to send a PHI in the format that the patient wants. A way to avoid this HIPAA compliance issue is to go ahead and send the medical information to the patient in the format that they want, while also informing them of the potential risks they may be taking if they receive it on a vulnerable platform. If you document their acknowledgement of that risk, you will be relieved of any liability you may have if their PHI gets leaked or stolen from being sent digitally. The last most common issue is that covered entities are disclosing more than the minimum necessary PHI. In past years, the concept of what it meant to share minimum necessary information was a bit easier to understand. COVID-19 has complicated the issue. The best way to avoid the problem of oversharing medical information in this pandemic age is to constantly stay informed on the current regulations related to the minimum necessary rule. I've included a link in this video to a document that the OCR created that will help you and your staff better understand what information you're permitted to share during this COVID-19 crisis. So there you have it, the top 4 most common HIPAA violations and how to avoid them. If you're feeling a little overwhelmed about conducting your security risk assessment, outlining your policies and procedures, or have no idea where to start with employee training, then you've come to the right place. MedCurity is here to simplify all your HIPAA compliance needs, from completing your SRA to training your employees on the most up-to-date issues. Want to learn more? Contact us today. We'd be more than happy to answer any questions you may have or even walk you through our platform to show you firsthand how we can simplify your HIPAA compliance needs.